All right, well, good morning, everyone. Thank you for joining us. Just want to let you know I have Ryan Loke here with me today, our Deputy Chief Operating Officer and Healthcare Advisor, to answer any questions that you may have on vaccine distribution. He's been working with Dr. Toomey's team for a long time now on that, and he can give you more in-the-weeds details if there's anything that we're missing in my remarks. I wanted to take just a quick moment before the weekend to give you an update on where we are in the administration of the COVID-19 vaccine as we continue to fight the virus here in the state of Georgia. As you all know, last week we announced that we would be expanding the Phase 1A criteria to include people over 65 and firefighter, law enforcement, as well as first responders. I'm happy to report that beginning soon, Georgians over 65 and those other priority populations can visit the Georgia Department of Public Health's website to find locations in your community where you can schedule an appointment for the vaccine. Also at a health department, pharmacy, grocery store, or even hospitals in certain locations. Not including the partnership between CVS, Walgreens, and Operation Warp Speed, the state now has the capacity to administer 11,428 doses of the Pfizer and Moderna vaccines per day. That is approximately 80,000 doses a week. As of today, we have administered 24.48% of the vaccines delivered to the state by the federal government. Today and through the weekend, there are 4 mass vaccination sites for healthcare workers in Metro Atlanta, located in Gwinnett, Cobb, Fulton, and DeKalb counties. These sites have the capacity to administer thousands of vaccines per day, and are already booked with appointments throughout the weekend. That is certainly welcome news as we continue working diligently to vaccinate the vaccinators, as well as our frontline healthcare heroes. Yesterday, as you know, I issued a new executive order allowing emergency medical technicians and cardiac technicians to administer the COVID-19 vaccine to those who are eligible in Georgia. Paramedics have always been able to administer the vaccine, and this order clarifies the other types of emergency medical professionals who are also eligible to administer. This important action, growing the number of people who can vaccinate by more than 10,000, takes us one step further to our ultimate goal of growing the number of people who can be vaccinated. I borrowed this phrase from Dr. John Lewin over at Emory over these last few weeks. As he said, vaccines don't save lives, vaccinations do. And I want to again express my deepest thanks on behalf of all Georgians to the doctors, nurses, public health officials who have led by example to receive the vaccine themselves and are in the fight with us now to continue its administration. As I have said when the first vaccines were administered in the state several weeks ago, this has been and will continue to be a heavy logistical lift for the state of Georgia. Dr. Toomey's team at DPH is working diligently with nearly 1,000 providers who have enrolled in the state's immunization reporting system to ensure that they are aware of the strict reporting requirements under their vaccine provider agreement. At this time, we believe there is a significant underreporting based on the state immunizations team's conversations with multiple providers. And we will continue our efforts to ensure the data is transparent, up to date, and accurate, as we always have. We are making steady progress. Local health departments are receiving high volumes of requests with very limited appointments. Phone systems, as you can imagine, are busier than ever. Public health staff have been working tirelessly for months to battle the pandemic and are working quickly to scale up appointments and call centers to assist the public in getting vaccinated. I'd like to continue to ask for the people of Georgia's patience as we work hard to swiftly, safely, and efficiently administer the limited supply of vaccine we have to those for whom it would be the most good to get it, including our first responders, frontline healthcare workers, our seniors, and staff and residents in long-term care facilities. We've also been working alongside Commissioner Frank Berry in the Department of Community Health to continue shoring up resources for our long-term care facilities. In October, I announced state support of nearly $78 million in aid for COVID-19 testing at our nursing homes through December. And today, I can announce that the state will continue those testing support efforts through June 30th of this year to find and mitigate spread of the virus while we work alongside our private sector partners like CVS and Walgreens to fully vaccinate residents and staff. No one has been hit harder by COVID-19 than the thousands of long-term care facilities in Georgia. We intend to stay with them in this fight until we ultimately defeat the virus. My message this afternoon to the people of our great state is the same as it has been for weeks. We have much hope on the horizon, but we've got to hunker down and continue to fight through this together. Continue to follow the guidance we've talked about endlessly. Wear your mask, wash your hands, practice social distancing, and heed the guidance of our public health officials that we have placed in our executive orders. I can tell you that our team has not and we will not take our eye off the ball. We will continue to work day and night to get this vaccine out and to bring an end to this long battle. We will get there together and ensure a safer, healthier, and more prosperous future in the Peach State.